B2 is riboflavin. Riboflavin is a very pungent yellow compound, and when you take it as a supplement, the first thing is that you have to warn the patient that their urine will go yellow. If it doesn't go yellow, it means that the patient is using it and holding on to it, but it's not unusual when you take a moderately high dose for the body to say, I can't use this all immediately, and it spills it out. So do warn the patient, because if you've never experienced this, the other thing is that it can cause a vasodilation along with niacin, as we see B3, and so the patient may develop a slight redness of the face and a yellowing of the urine, which may concern them, in which case probably just reduce the dose back down. Riboflavin has two coenzymes similar to B1, so riboflavin mononucleotide, or FMN, otherwise colloquially called riboflavin 5-phosphate. This is the name that commercially you usually buy it at, but the biochemistry name is flavin mononucleotide, and this will go on further to flavin adenine dinucleotide, and the adenine part comes from ATP, adenosyl triphosphate here, and this can be in the oxidized or the reduced form with an H afterwards. So basically riboflavin acts as an oxidoreductase, in other words it donates the hydrogen or accepts the hydrogen. This is how it works here. Just going back to here, the activation of riboflavin and depends upon T3 and T4, which is the biologically active forms of thyroxine, okay, particularly T3. So this is really how thyroxine works in relationship to the metabolic rate. So thyroxine, or thyroid hormones, allow the body to make more active form of riboflavin, the FAD here, to put into the mitochondria. So it burns, if you like, the FADH will supply the hydrogens to go into the mitochondria to make the final part of energy here. So if we have low levels of thyroid, we don't do that conversion as effectively, and that's why we get tired. Okay? So that's the way that thyroxine, or thyroid hormones, actually work. This is in the body, is how they actually stimulate the production of FADH2, which is what goes into the fuel of the mitochondria. So the flavin comes from the word flavus, referring to the yellow colour that it's in. Usual sources are dairy, lean meats, leafy green vegetables, grains, etc. Sufficient intake is important to help the body convert carbohydrates in the Krebs cycle, as I said, to neutralize free radicals within the pathway called glutathione reductase. So it helps the conversion or activation of B6 into pyridoxal 5-phosphate, and B9, which is otherwise known as folic acid, into its activated forms. European Food Standard allows you to make claims of normal energy production, because it's involved with energy, normal metabolism of iron in the body, maintenance of normal skin, and the maintenance of normal red blood cells. Maintenance of vision, protection of cell constituents from oxidative damage, and normal functions of the nervous system. Individuals who have inadequate levels of B2, particularly children, poor economics, dieters, and vegans. Symptoms include fatigue, slow growth, digestive problems, and the key one here is the cracks and sores around the mouth, okay, otherwise known as chelosis. So anybody who gets cracked lips, basically, when the cracked lips get there, and you see this quite profoundly in some people, don't you? They go one particularly down the middle there, a big crack there, and it never seems to really heal up, and you know, they're dry in the skin there, and they smile and it sort of starts to open up and crack again. Very disturbing there. They may have swelling and soreness of the throat, but the key one always is this cracking and soreness around the mouth, or chelosis. So that tells us about the activated forms. There's a lot of enzymes that depend upon oxidation and reduction. Reduction means adding a hydrogen or an electron, and oxidation means removing it. So a lot of enzymes in the body, that's just simply all they do. They donate hydrogens or they remove it, as we'll see as we go along. So there's an awful lot of these involved there. It's relatively heat stable, fluorescent orangey yellow colour, and will decompose under visible and ultraviolet light. So this does mean that it deteriorates when the food is left out in the light. So again, as long as the food is put in the fridge in the dark, it's relatively heat stable. So the enzymes are called flavo or riboflavin type enzymes. They contain one or more metals, like molybdenum is a very common one which we'll come across, and copper. They're widespread and important for amino acid breakdown, deamination, and the detoxification of aldehydes and sulfites. And one of the most important enzymes in the body is glutathione reductase and oxidase, which helps us to the major intracellular oxidant in the body and detoxifier. So here we see a picture that we're going to come back to when we look at pyridoxal 5-phosphate, and here we see FAD or B2 being involved in the activation of pyridoxine or B6 into the active coenzyme pyridoxal 5-phosphate. So interestingly, we can now see that if we go back to the beginning of how we make flavin, adenine dinucleotide, with the thyroxine hormones and magnesium and ATP, these in turn activate FAD, make FAD. FAD in turn activates pyridoxine to pyridoxal 5-phosphate. And as we see, pyridoxal 5-phosphate in turn activates folates into the active form of folates. So we can end up with a patient who has the symptoms, let's say, for instance, of folate deficiency, but the cause is actually down the chain, okay? And with applied kinesiology techniques, functional biochemistry, we can say, oh, actually the cause is a lack of B2 or even a lack of magnesium or lack of thyroid hormones, that what they end up, the symptoms, may not be actually the cause. Whereas most medical approaches is to look at the symptoms and put the symptoms together. And we pride ourselves that most patients only have one problem, basically, and lots of symptoms, okay? Whereas to an alternative way, more pharmaceutical way of looking at it is the patient has a whole group of symptoms and they have multiple causes. This is very rarely the case. Usually what your job is to find out the cause, and that should negate all the symptoms of the patient because the body is holographic. In other words, everything is a part of the expression of what's going on with the person. So we'll come back to this picture. Some medicines like ACTP can inhibit the conversion of riboflavin, again because most medicines work to block enzyme pathways and therefore can block the production of adrenal cortical hormones, etc. Early symptoms are inflammation and also the side of the mouth. Cheilosis, which is fissures, we said, of the lips here, and glossitis along with that, which can be a shiny tongue, which is very red and inflamed. When I looked that one up, there's various permutations on that. There's all sorts of tongues. There's a whole system in Chinese medicine and Chinese tongue diagnosis, which I guess, you know, they've represented and already seen that the tongue is a vital dipstick, as Jeff Bland calls it, of the gut. So when the gut is wrong, the tongue goes wrong. So if you want to look at the colon in a person, you look at the tongue. So if you think, oh, the tongue's red and thing, you think that's probably going on in the colon as well. Deficiency of B2 may also occur with phytotherapy, such as intense ultraviolet sun tanning, which we said is unstable in ultraviolet. Patients complain, I have this pain in my legs, so I stop walking and it goes away. This is classic of intermittent claudication, isn't it? In other words, you've got not enough blood getting to the muscle. So the B2, remember, is a vasodilator, so it opens up the blood vessels and allows more blood flow through there. So that's part of the G complex that Worley called there. So it's a vasodilator. Sources, we said, are enriched grains, etc., meat, poultry, seafood, spinach, etc. Normal intake is 1.7 milligrams, and probably the muscles associated with B2 that David Walther puts down are the neck extensors. What we're going to do is take the head slightly back into extension, not too far there, and you're going to push back against me. Remember, if this is weak, well, the patient will go forward like a whiplash, so push back, okay? And then we're going to, that's as a group, and then we're going to turn you just slightly there to bring the extensors on the right-hand side. And then we're going to turn you there, a little bit of extension there, and push back again. Good. Okay, so you're nice and strong. So B3 is a collective name for the different coenzymes of vitamin B3. The inert compound starting block is called niacinamide, or niacin is really the collective word for all the different forms of B3. So we see here niacinamide, which goes on to nicotinic acid in this route, or down this way to nicotinamide mononucleotide, and then nicotinamide adenine dinucleotide, or more commonly called NAD, or NADH if it's the reduced form. If we take this route and use the nicotinic acid here, it then produces ultimately the same compound, but through a different route of the nicotinamide adenine dinucleotide. Nicotinic acid is the one form which causes the bigger vasodilation. So it's not very popular as a food supplement or to be added on, except there are some people who swear that they like to take nicotinic acid because it actually opens their blood vessels up and it clears out all the old debris. Now, I've done it myself by mistake in the middle of, or I think it was lunchtime in the clinic, and took some and found the first patient said, "Oh, are you all right?" So I said, yes, I'm fine, but you're very red. So I said, "Oh, am I?" So I looked in the mirror, and of course I was bright red on the face there. Went out to the receptionist, and all the receptionists, "What's the matter?" And then it started to pulsate, sort of throb there. And it lasts about half an hour, 40 minutes, and at least you know it's going to go off then. So I never really use nicotinic acid, except when people actually ask for it. And surprisingly, we do have groups of people who say, "I'd like a bottle of your nicotinic acid." So it is the nicotinic acid, which is the flush one, whereas nicotinamide or niacinamide is a non-flush, more or less, version of it. But both end up making NADH, nicotinamide adenine dinucleotide, and from there we can then further phosphorylate with ATP as the donor there to make nicotinamide adenine dinucleotide phosphate, or NADPH. Now, sometimes in biochemical equations you see NAD, okay, and sometimes you see NAD and the P is in brackets. Now, when you see NADP in brackets, it means it can either use NAD or NADP, okay, if it's bracketed. If it specifically says NADP, then it has to be NADP, okay? And the same with NADH. If the H is bracketed, it means it can be that one or the other one. So when it's bracketed, it means it can use either type, all right? And there's a certain amount of duplication with that, although there are some biochemical pathways which are strictly NADP or NADPH. Now, we can make NAD and NADPH from the amino acid tryptophan. So technically, niacinamide is no longer a true vitamin. A true vitamin is something which has to be got from our food and that we're unable to make. So it's actually lost its status, really, of being called B3, because the body is able to make it from a conversion of tryptophan through quinolinic acid up into nicotinamide mononucleotide and this sort of pathway. It's not a very efficient way, but it does mean that if you don't take any vitamin B3 in at all in the diet, you can actually make it from the aminotryptophan. So that's reduced the number of vitamin Bs that you have to get. So on the subject of vitamin Bs, some Bs are by their name, and that means they're not a true vitamin. The body can manufacture it itself. If it's a true vitamin, it has the number 1, B1, B2, B6, B12, etc. Okay. So the term niacin refers to the whole group there. Usual sources: yeast, liver, poultry, lean meats, vegetables, etc. It can be made, as I said, from the amino acid tryptophan. It's most important to convert glucose, so it's involved again with the energy pathways. It helps in the production of fatty acids and cholesterol. It facilitates DNA repair and stress. European Food Safety says you can label it as normal energy producing metabolism, normal function of the nervous system, maintenance of skin, normal psychological functions, and reduction of tiredness. You see, there's none of those are actually medical claims in any way, but they're all fact that they help to reduce or prevent issues. In developing countries, B3 is rare. Alcoholism the prime cause. Symptoms may be fatigue, indigestion, canker sores, vomiting, and depression. I think they're going more to developing now the fact that NADH is involved with the aging process, or lack of it, and the energy production, and that lack of energy is the cause of most people, most cells getting older. And if you can't reproduce your cells and make new DNA and things, this leads ultimately to the aging process. So now there's a lot more interest in NADH as an anti-aging compound. So it may be that to the recommended daily allowances, deficiency is rare, that you've actually got a disease called pellagra, but on the other hand, it may be conditionally in some people that most of us are deficient as we get older, to some extent. So we've said about that, we've said about that, we've said about being able to make it from tryptophan. That's the process itself of making it from tryptophan. Common enzymes, there's lots and lots of enzymes, including alcohol dehydrogenase, which is why alcoholics tend to use up their vitamin Bs quicker, is because these alcohol dehydrogenase oxidizing enzymes are all B3 and B2 dependent. So you can see the list goes on a lot of the different ones, and again, glutathione, the intracellular antioxidant there, and the delta-6 desaturase enzymes here, which are the ones that help to activate alpha-linolenic and linoleic acids into GLA and EPA, which we'll discuss in the fatty acid module. We'll see here it's also involved with the vitamin D activation, as we can see here, the 25-cholecalciferol and the 1A hydroxycholecalciferol. So all the activations of the vitamin D to the biologic active forms all require B2 in the processes then. Besides the oxidation reduction reactions, it's required for the repair when we have ultraviolet damage to our skin from too much exposure. So the classic pathological problem is the 3Ds, or pellagra as it's called, which is diarrhea, dermatitis, and dementia. So not a very good, happy picture there, but this is in extreme cases, of course, of dietary deficiency, which used to be common in the East and Middle East because of the refining of rice and losing the vitamin Bs from the rice polishings there. But there are some certain symptoms of low grade of this still, and maybe a big role in dementia, because dementia is a lack of production of energy in the brain, and therefore the brain atrophies as a result of it. We've mentioned about sources there. Daily recommended a little bit higher, 20 milligrams probably. But remember that, of course, you can make some of that by the amino acid tryptophan, and I suspect that's what most people do, is because when you look at a lot of these whole grains, livers, etc., people just don't get those in the diet, but they don't show that they actually are deficient in vitamin B3. Muscles associated with B3, gracilis, this is an adrenal-related muscle, the neck extensors, which we saw with B2, pectoralis minor, which is to do with the immune system, and sternocleidomastoid. So what we do is we just take the neck flexor, we'll use this one on this side, so push up against my hand, and if you could pop a few grains of NADH. We use NADH, which is the reduced form of it, on the tongue, and we lift up again, and push against me there, and now we've got a good strengthening here. So this one works really well for you, is NADH. Okay. So we'll have a look now at vitamin B5, colloquially called pantothenic acid. Again, a non-essential vitamin, which used to be called B5, but now is called pantothenic acid or calcium pantothenate, because it usually is salted or comes as a salt rather than a pure liquid. So pantothenic acid, which we get from our food here, goes through a series of changes which requires the addition of cysteine, the amino acid, pyridoxal 5-phosphate, and then this makes the intermediate called pantothene, which then goes on to form eventually coenzyme A. So CoA is the active coenzyme of vitamin B5. It's a group of water-soluble vitamins. The name pan or panthos means everywhere. So basically it's substance which is in a lot of different foods. the first time they actually got to understand what the deficiencies were with victims of the Far Eastern War and the Second World War, with prisoners who were denied all sorts of foods apart from a bit of white rice each day, developed tremendous deficiency diseases, including osteoarthritis. And so there was this fact that perhaps pantothenic acid was actually involved with the creation or helping osteoarthritis, because all these prisoners were all recovered when they were put on proper diet and pantothenic acid supplemented with them. And in fact, pantothenic acid is part of actually making glucosamine in the pathway, as we'll see in making cartilage later on. So it's rich in, again, our offal, our kidney, liver, heart, eggs, milk, vegetables, etc. So it's in most of the common daily foods there. So it's important in the conversion of food into glucose, the breakdown of fats, carbohydrates and proteins in energy production. It helps in the synthesis of cholesterol. So actually cholesterol is made from acetyl-CoA, or the active form of B5. It helps to form red cells and stress-related hormones. It can be called, from the European Safety Authority, normal energy, normal mental performance, normal synthesis of certain vitamins like D, and reduction of tiredness and fatigue. Groups at risk, again, are going to be alcoholics, people on severe restricted diets, women on oral contraceptives, people with impaired absorption due to intestinal diseases. These are the enzymes that use it. Pyruvate dehydrogenase, again, the conversion of pyruvate into acetyl-CoA, the formation of carnitine, and the burning of fats in the mitochondria. Very important in the synthesis here of phospholipids, and particularly of myelin, which we'll come on to in a later module. And here's the key here, the most important thing is the deficiency. The one thing which we will always bring it to mind is the burning foot syndrome. Okay, so whenever you hear somebody say, and they do actually say, my feet burn, and they're not walking on hot coals at the time, but they have this sensation of burning feet. And this is classic of B5 or pantothenic acid or acetyl-CoA. They may have anorexia, indigestion, abdominal pains, heel pains and so on, all the other sorts of depression and psychosis, but the burning foot is the key clinical condition that if you hear that, like the sweaty head that we talked about with vitamin D, there's just simple symptoms and you think, I know what that is. Remember those key words, key thing, burning foot syndrome, like we met with B2, cracking of the lips, the 3 Ds with diarrhea, dementia with pellagra. So sources, again, we've mentioned those, all the offals and beans and broccolis and things. Daily amount, 10 milligrams is usually quite sufficient there. The only muscle here which is associated with the David Walthall mentions is the sartorius muscle, because B5 is involved in the production of cortisol, in the production of steroid hormones. So what we'll do is we'll have a look and see if we can check out a sartorius muscle and check it with CoA. So for sartorius, we're going to bend the knee up to 90 degrees there, slight hip flexion of course there, take the hip into abduction and lateral rotation, and David's going to pull his heel here up towards his bottom, and I'm going to stay below the knee here, and you can see that it opens up quite easily. So the sartorius muscle, which runs along here, stabilizes the medial part of the knee. Pull up. There we are, no strength at all. So if we pop on a few granules of CoA, which is basically the active form of pantothenic acid, and we'll see if this makes a difference with him. So pull up, and we can see there's a little bit of an improvement, but not really sufficient to say this is rock solid. Yeah. Okay, so in your case, the B5 or the CoA is not the optimal remedy for you, but you do fulfill the requirements of a weak sartorius. Okay, that's it. So B6 or pyridoxine, the raw vitamin, is the activated coenzyme that's called pyridoxal 5-phosphate. Now, pyridoxal 5-phosphate can also be made from other forms of B6, pyridoxal and pyridoxamine here, but the most common route is by pyridoxine here through the kinase enzyme and the oxidase to make pyridoxal 5-phosphate. Now the original pathway here, the kinase enzymes always use ATP in the process, and they also use magnesium, so that all kinase enzymes are magnesium dependent. Okay, so we know that all enzymes have cofactors, minerals, to get them to work, and many enzymes also have coenzymes in order to do this. So in this case, we need magnesium, always with kinase enzymes, and we also need zinc, and we see manganese and even cobalt here are important in the process of the conversion here. Then we add the phosphate group from adenosyl triphosphate, which makes pyridoxine 5-phosphate, and then we oxidize that by FAD, which is the active form, as we've seen, of B2. Now, whenever you've got something which stimulates an enzyme, cofactors and coenzymes enhance it, you've also got things that can inhibit it or poison it. And this is the way that many drugs work, is they inhibit enzymes from functioning, and of course many toxic substances. This is why a drug is a drug. It's not because you're deficient in the medicine actually has an inhibitory effect on the symptoms or the problem. So this is why you only have a small amount of the drug, 1 or 2 milligrams, let's say, because if you had a gram, you'd die, okay, because it is a poison. And people don't realize this, do they? When they take drugs, they think, oh, this is a medicine, this is essential for life. It may be, but it's not solving their problem. In fact, it's doing pleiotropic effects in other pathways as well. So here we see theobromine. Theobromine is something made, a substance in chocolate. So people who eat a lot of chocolate may, if they've got problems with theo, inhibit the production of pyridoxal 5-phosphate. Caffeine. So again, large amounts of caffeine coming into the diet may affect your ability to activate this enzyme. And levodopa, which is the form of the making L-dopa into dopamine as a medication, may affect the production of pyridoxal 5-phosphate. So there's a big tie-in, as we'll see later when we come to doing neurotransmitters in future module, that pyridoxal has a big role in the production of dopamine and other brain chemicals. So it's water-soluble, it's found in the different forms, as we say, but pyridoxal 5-phosphate is the activated form, which occurs mostly in the liver. Excellent sources of B6 are most livers, chicken, pork and veal. Good sources include fish like this, nuts, a variety, and generally vegetables and fruit are less important for vitamin B6. Adequate intake is essential to convert food into glucose and make neurotransmitters and certainly many hormones. There's hardly a neurotransmitter or a hormone that doesn't involve pyridoxal 5-phosphate either in its synthesis or its metabolism. It's involved with the production of red cells, particularly in the production of heme from making through the porphyrin pathways, which we'll look at again in the future module using hypoxia. It controls along with the regulation of B12 and folic acid. Blood levels of homocysteine can be regulated with P5P as well, because this helps to metabolize homocysteine down to cysteine, and high levels of homocysteine have been implicated in heart disease and cerebral vascular accidents. European food safety says normal protein and glycogen metabolism, so it helps us to break glycogen down to produce energy, stored starch. Function of the nervous system, red blood cells, the immune system, hormone activity, homocysteine, energy, cysteine synthesis, and psychological functions. In fact, it's the most common because of its relationship to forming and breaking down various hormones and brain chemicals. It produces all these psychological functions. You know, it can be stress with one person and depression in another. So B6 alone is uncommon, which is true, because most people that we find require pyridoxal 5-phosphate and not pyridoxine on its own, unless you're on a very strict sort of controlled diet. So populations at risk would be pregnant and breastfeeding women, oral contraceptives, elderly people, underweight, and alcoholics. Symptoms could be of any of those psychological irritabilities, depression, confusions, inflammation, skin, etc. A major form present in the plasma is P5P. Main function here is decarboxylation, in other words, the removal of the carbon dioxide from the substrate to the end product. And transamination, which means basically the breaking down of amino acids, recycling of them, always requires pyridoxal 5-phosphate. Transsolvation we're going to be looking at again in module 4 next weekend, and also the production of heme through porphyrins. There's over 76 different enzymes in the body which require pyridoxal 5-phosphate as a coenzyme. There's the transaminase. We'll take this one just an example is aspartate aminotransferase, which is a liver-related enzyme, otherwise known as GOT. This is one of the liver function tests. And alanine aminotransferase, otherwise called glutamate or GPT. These are standard liver tests that's come back with the results of high or low if you've got liver dysfunction, but they always respond to pyridoxal 5-phosphate. So really what they are, from our point of view, are functional tests for pyridoxal 5-phosphate or B6. So we'll skip through those. Low stomach acid, hypochlorhydria, is the major cause of morning sickness because to produce stomach acid you need B6 or histamine to regulate the production of stomach acid. If you get acid and there's no food in there, you get morning sickness there. It gets out of regulation there. So every time you hear of anybody getting morning sickness, particularly in the first 3-4 months of pregnancy, that's pyridoxal 5-phosphate, okay? And you'll always notice that with the person has that, a girl has that, lady has that, for the first baby, they get it worse for the second, and even worse for the third one, subsequent ones. And sometimes you hear cases where the girl is actually hospitalized because the morning sickness is so bad. This is always pyridoxal 5-phosphate. You can see it whenever somebody goes into hospital for morning sickness, in some celebrity, somebody famous there, think pyridoxal 5-phosphate there. You might want to send them a little message on Facebook or something and say, have you tried pyridoxal 5-phosphate? You might get a knighthood. Okay. So DOPA decarboxylase, again, very important conversion, as I said, of L-DOPA into dopamine, again, which we'll spend time on later on in the modules. So we'll go through these different enzymes in detail when we come to them. So one which we'll be looking at again quite a lot, this picture with the folates and the B12, is really the what's called the one-carbon cycle, which is starting with methionine, the essential amino acid, which goes through to make S-adenosyl methionine here, or SAM, which is the universal methyl donor. So all methylation pathways require S-adenosyl methionine to be the donor, the methyl donor here. This then goes on, converts to homocysteine, which is that intermediate amino acid en route to making cysteine, the amino acid here. These are all sulfur-bearing amino acids, so they all have that sulfur smell. Now, homocysteine can cause damage and weaken collagen. It inhibits the final lyase pathway of making collagen. So the collagen, particularly in the blood vessels that holds us together there, can get weakened very quickly, and that predisposes you to cerebral vascular accidents and aneurysms. So we get rid of homocysteine normally through the cysteine B synthase enzyme here, which requires B6 or pyridoxal 5-phosphate and vitamin C. So you know people who, as we'll see, who get B6 and vitamin C deficiency, they get petechial hemorrhages very quickly. You know, they hemorrhage and bruise very easily here. Now, we can also recycle homocysteine, which needs a methyl donor to change it back to methionine, and we get that from methyl B12, who in turn gets it from methyl folate. So this recycles homocysteine, and the reason we recycle it is so that we can get more methylation again. So it's a pathway where we revolve it around. So some people actually weaken to homocysteine if they've got a build-up of it, but some people strengthen to it if they need more SAM. So it's a good and it's bad. It's an intermediate substance. It's a natural substance of the body, but when it's in excess, it's a problem, and when it's in a deficiency, it's a problem. Now, there is an alternative route, as we'll see later on, to also making another methyl donor from the non-essential vitamin B of choline to betaine. So that's another route in the liver of putting methylation defects to recycle homocysteine. So the reason we're talking about that now is the pyridoxal 5-phosphate, or B6, is the main cofactor, coenzyme for converting homocysteine to cysteine. So this methyltransferase pathway, that's what we talk about. We'll come back to this picture because this is important in the folate, when we do folate as the next vitamin. Pyridoxal 5-phosphate affects the metabolism of alpha-linolenic acid to making these long-chain EPA, DHA, omega-3 acids, fatty acids, which are important in the central nervous system. So deficiency can lead in some people to attention deficit hyperactivity, or ADHD. It can lead towards incomplete synthesis of heme en route to making heme and hemoglobin. We'll go through this when we look at hypoxia in later modules. Deficiencies is, I sometimes get this myself, is a rough skin. So if your skin starts getting rough, it means the proteins on the skin are beginning to break down and you're not replacing those in the right way. And so you get this rough skin, particularly on the back of the hands there. So you think, oh, I must put some more cream on there. But my big problem personally when I was a teenager was mouth ulcers. And mouth ulcers are the real plague of a lot of teenagers, particularly as you come into sort of 13, 14, when the hormones start kicking in, because you need a lot more B6 to make your testosterone and things. And at that time, you know, we used to play a lot of sport, which obviously used up a lot more vitamins as well. But one of our favourite things and pastimes was the swimming baths, the swimming pool. And in those days, you could spend all day there. You're probably not allowed to do that. You'd only have an hour to go into there. But we would happily go down to the swimming pool all day, you know. And you would come out shrunken and white and, you know. But it would increase, and we never knew why at that time, increase the incidence of mouth ulcers. And I tried many different remedies from different doctors, including potassium permanganate in the mouth. And the only one that really worked to some extent was a vitamin C lozenge. And boy, did it sting on the tongue or the cheek. But it did help the healing. But it was many years later when I started doing applied kinesiology, and I had a patient who had been plagued with mouth ulcers. She was an older woman, but she talked to me about this and, you know, how she'd had it probably all her life. And I thought, I'll just get my test kit out of all the nutrients and we'll go through every single one. And we spent a long time doing this, and we came up, it was positive. She therapy localized the ulcer, and it was pyridoxal 5-phosphate. And it's worked in 95% of cases since. Occasionally, you know, 5% could be one of the folates, because there's certain crossover of some of these B vitamins in their function. Occasionally it's a folic acid or an activated form of folic acid deficiency. But the way with a mouth ulcer is you therapy localize it, strong muscle goes weak, and then you test, and you'll find that pyridoxal 5-phosphate will be the major thing in 95% of it. And then as years went by, not only did this work well, but the same process of the lack of being able to rotate and remake, recycle proteins was in all ulcers. So this was stomach acids as well as stomach ulcers, duodenal ulcers. So when there's an ulceration, think pyridoxal 5-phosphate, and varicose ulcers. So we now know, of course, varicose ulcers are varicose veins, which is a lack of collagen, which is high homocysteine. So you begin to see, I can see how it builds up, that you lack the pyridoxal 5-phosphate ability to make it, to synthesize it, and then you start getting symptoms of lack of collagen, etc. And then it comes on as in one person it's a varicose ulcer at a certain age, and other people it could be a stomach ulcer, and other people mouth ulcers. But I have had some, one gentleman, he's in his 50s now, and he gets them right on the back of his throat. You know, you can see them from those, but every time he swallows, it's just living hell. And his is pyridoxal 5-phosphate. But they're not on the tongue, not on the cheek, but on the back of the throat. You know, you can imagine how painful that's been for years. And, you know, it's saved his life as such, really. So all ulcers are related to pyridoxal 5-phosphate, and maybe, you know, 5% are folates. So gastric and varicose ulcers, depression, premenstrual syndrome, mainly because it's involved in the conversion of pregnenolone into progesterone. And a lot of premenstrual tension and depression and menopausal sort of symptoms are due to lack of progesterone, which is made from pregnenolone, which is made from cholesterol, and these pathways all need pyridoxal 5-phosphate. And a lack of P5P allows oxalates to build up, and oxalates are stones, if you like, of calcium, usually calcium oxalate, which would normally be broken down to form this pathway to make glycine, the amino acid. But if you've got a deficiency of pyridoxal 5-phosphate, it shunts this particular pathway into making more oxalates, and then that can lead to kidney stones. We talked about homocysteine, high homocysteine, and of course these are quite common as well. They're called Campbell-De Morgan spots. These are the little blood spots, okay, which a lot of people have, these little blood spots. They're bright red. A good colleague of mine, Hans Garten, in Germany, when you know, we've worked together years ago, he's a good acupuncturist. He used to stick needles in them and pop them, and they would disappear, and then, you know, another one would come later at a date there. They come and they go. If you look at this picture and you take another one in a year's time, you'll probably find they're somewhere else. The body will heal them, but they keep coming back and back and back. And what they actually are is aneurysms. If you see these are burst blood vessels, burst little arterioles, so they're really quite serious when you see them, although they're just, you know, slight blemishes. But when you see them, they are actually hemorrhages from aneurysms. And if you get that on the skin is intimately related embryologically to the brain, you may be getting these in the brain as well. So I don't want to worry you if you got these, but you need to do something about it is the answer. And what do you do about it is simply use therapy, localize it, and you challenge them with pyridoxal 5-phosphate. And that's a sign that they've probably got high homocysteine, and they're weakening the collagen in the little blood vessels when you see this. So we'll check out for Campbell-De Morgan spots in a minute. Patients may complain of a snapping finger. This is when the finger gets stuck like that and they get, you know, don't know. We call it a trigger finger, really. George used to call it a snapping finger, and it wasn't locked, not like a Dupuytren's contracture, but it would just get stuck in that position. And it's usually when the tendon slips over and gets slightly out of position now. Otherwise known as a stenosing tenosynovitis, as the flexor extended tendons. It's usually palpable in there. Sources, brown rice. Brown rice, in other words, the polishing, the bran of the brown rice is one of the richer sources of B6. The only thing, of course, with brown rice is you've got to make sure it's organic, and because they do spray rice, or they use a pesticide which is arsenic-based, and rice does tend to grow in areas where the water contains arsenic naturally anyway, and so there's always going to be arsenic even in organic brown rice. But if you get organic, it's going to be less than having the pesticide on as well. What programs on television have indicated when they've researched the arsenic level is that ideally you should soak the rice for 12 hours before cooking. And this seems to reduce the amount of arsenic down to less than 20% of what it was before you put it in. So obviously you plan out tonight's meal. If you're going to have it, you know, put it into water, cover it over, leave it for the rest of the day, ideally 12 hours, and then wash that water away. Don't use that water obviously to cook, okay, and then wash it away and then cook your brown rice. And that way you have the minimum amount of arsenic in it. So brown rice is a good source of B6. Remember, it's not pyridoxal 5-phosphate, it's B6, which you'll then go on to convert if your liver's working fine. Other sources will be seeds, cereals, fish, chickpeas, fruits, etc. Potatoes. So George says people who do not dream require pyridoxal 5-phosphate. This is interesting, isn't it? Do they dream or do they not remember? I think it's more that they don't remember their dreams, because I think most people do dream, because sleep studies have shown the rapid eye movements do occur when we dream, but not everybody remembers their dreams. In fact, we only really remember the dream when we wake up, don't we, of what we've just had. Occasionally, you've woken up in the middle of the night from a dream, and it's been a bad dream, and it's been difficult to go back to sleep. Occasionally, Jill will have a thrashing around and a whimpering, and I'm sure probably I do occasionally, sometime during the night. And when this occurs, your immediate thing is to wake the person up, but the best thing is not to wake them up, in fact, just to leave it and let it take its course. So I said, "How was your night?" "Oh, fine," So she's never remembered that, thank heaven, because it was in the middle of the night. The only dream you seem to remember is the one just as you wake up, isn't it? You remember that because that's in your consciousness. Luckily, the rest are just jumbled up. Most of them are just jumbled up, subconscious memories and things which get jumbled up and all come, and basically they're a load of rubbish most of the time, but sometimes they're not. And so if a person's having a bad time during the night, just leave them, because they won't remember about it with a bit of luck. So probably the deficiency is more of people who don't remember their dreams rather than don't actually dream at all. What George used from the works of Raleigh is that an extract of urea helped people, in this case, who have sleep problems, and particularly if they get a lot of funny dreams, is a carbamide, it was called, which is a urea extract, helps people to sleep much more calmly. Think P5P in cases of acne. You know, this is really not a very nice picture. Acne can come in various forms. Acne vulgaris can also be used, George said, as a cream. Our feeling is, again, research, is that zinc usually shows up with acne as far as repair of the genes, and iodine to help balance the hormones, because most acne is related to imbalances in the hormones, in the steroid hormones. George says soft nails use calcium, flaking nails use B6. So soft nails are going to be sort of a bit bendy there, but flaking is when they flake, you know, when they split a lot there. And the skin tags, you know, when you get those little skin tags at the side of the nail, which can be so painful if you catch them and try and bite the skin tag off, that's a sign of pyridoxal 5-phosphate deficiency. So whenever you get the skin tag there, think that. Lined nails, he always said, that's the vertical lines, is iron, whereas horizontal lines tends to be much more zinc, doesn't it? But nothing's 100%. He said use B6 and B complex for cataracts. Okay. We tend to find that with research, vitamin C is also very important here, because vitamin C is richest, in fact, in the lens of the eye of almost any part of the body there. So the vitamin C is to act as an antioxidant against the environmental pollutants that can cause oxidative reactions. Use B6 and B complex for women using the contraceptive pill, because this tends to change the amount of estrogen the person has, and to help with the metabolism of the estrogen, they often need extra B6 if they're on a contraceptive pill. So if a person shows to P5P who's on the contraceptive pill, they may need to stay on that all the time that they're taking the contraceptive pill. Use B6 and E for mouth ulcers. Well, we've talked about that. The other one with B6 definitely is fluid retention, possibly again because of this oxalate build-up in the kidney, maybe. And David Walther talks about being able to put the pads of the fingers here onto the hand like that. Okay, so if you've got a P5P deficiency, you tend to retain fluid, and then the fingers don't go flat onto the palmar malar part of the hand there. Do you see what I mean? Like that. So people with pyridoxal or with fluid retention can't do that. And of course the most common area of fluid retention in the hand is when people get the carpal tunnel syndrome. And they found that probably 75% of carpal tunnel conditions are resolved by taking pyridoxine for about 3 months. Interestingly, 25% doesn't make any difference, but probably the reason is they don't use pyridoxal 5-phosphate, they use pyridoxine. So it'll be an interesting research to do of using P5P as opposed to pyridoxine there. So what we want to do is just press in the distal end of the carpal tunnel here and squeeze fairly firmly with the pad of the finger, and we can see fluid accumulating there. Not to a great extent here, but enough that we can see a little bit of fluid coming out of the carpal tunnel and being displaced to the side there. But with the carpal tunnel syndrome, of course, there's a lot more fluid in there, and you can push it out there when you get pressure on the median nerve, creating paresthesia of the fingers there. Okay. Associated with the P5P, pyridoxal 5000, is the opponent's digiti minimi. This is the one that opposes the thumb into there, and that's the one we classically use because it's a median nerve for the carpal tunnel. Sartorius and again sternocleidomastoid here. So opponent's digiti minimi brings the thumb and the little finger together. So we don't do this. This is different muscles. This is the flexor pollicis as opposed to the opponent's. You hold onto the distal end of the first metacarpal here and the fifth metacarpal. So you're going to bring here to here together. Okay, so pull together. And we can see that that opens up. Now, if you now get hold of the distal end of your wrist here with the other hand and squeeze it together, okay, and then push the thumb, you'll see that it's nice and strong. So if you let it go, push together, see this is a classic case of where we've got weakness of the median nerve operating the opponent's pollicis there. So let me do that once more. So in the clear there, weak, you squeeze together hard the radius and the ulna together, which takes the pressure off the carpal tunnel, push together. So we may find, so if we do some B6 on there, or rather pyridoxal 5-phosphate, and put a few granules on the tongue. So if you do that, and let's have a look and see how much, whether you can get the hands flat. Yeah, more or less, but it is a bit tight, isn't it, in there? So particularly if you try this in the morning and see if the morning time you're a bit stiffer than what you are in the evening time. So Joe's just going to pop, stick your tongue out. Okay, so we'll now do glandra again, push together, and here we see now it really tightens up very nicely. So perhaps, and again we're looking in isolation, perhaps a little bit of pyridoxal 5-phosphate might not go amiss as it strengthens you up. Okay.